Good day everyone! So in today's video, we're going to do the Leopold's maneuver procedure. So its objective is to determine presentation and position of the fetus and aid in location of fetal heart sounds. So for its materials or equipments, we have here the pair of gloves and stethoscope. So now, let's proceed to the procedure steps. So the first thing we're going to do is assemble all the necessary equipments. Next, we have to introduce ourselves and verify the client's identity. Good day, ma'am. I am Julina M. De Villa. I am your student nurse for today. So I am from Medici de Makati College. So I am here to do the Leopold's maneuver procedure. So I will do this in order for me to know your baby's fetal position, presentation, and most especially your baby's fetal heart tone. So may I just verify your identity? Okay, ma'am. Can you state to me your full name and date of birth?
Rose Ann Manalo, July 21, 2004.
Okay, so when was the date of your consultation?
February 3, 2021.
Okay, thank you, ma'am. And after that, we must provide privacy for our patients. So for my assessment, my client, Miss Anne, is approximately 36 weeks pregnant. So Miss Anne, at the end of this procedure, you'll be able to know your baby's fetal position, presentation, and most especially the fetal heart tone. So Miss Anne, I will be discussing to you the 4 maneuvers that I will be doing to you and to your baby. So the first maneuver is knowing the fetal presentation of your baby. So I'm going to palpate your uterine fundus and know which part occupies your uterine fundus. So if I touches hard, firm, round, and moves independently of the trunk, it means I'm touching your baby's head. And if I touches soft, symmetric, small bony processes that moves with the trunk, it means I am touching your baby's buttocks. So, in here, the first maneuver also distinguishes between a cephalic and breech presentation. Okay, so for the second maneuver, I will be palpating each side of your maternal abdomen to determine which side is the fetal back and which is the extremities. So for me to know if I'm touching the fetal back, I will feel firm and smooth. While in fetal extremities, I will feel like small irregularities and protrusions. And to add up, in fetal back, we will be knowing the fetal heart tone of your baby. So for the third maneuver, we will be knowing if the baby is engaged or floating. So I will palpate the area above the symphysis pubis to determine the presenting part and if the fetus, like I said, is engaged, and this will validate the findings of the first maneuver. And for the last maneuver, this is the fourth maneuver, I will be palpating the directions of the pelvic inlet using the 3 fingers of each hand and determining the presenting part. So this maneuver is less informative and if the presenting part is breech. And here we will be knowing the presenting part, either vertex or face. So for vertex, it is cephalic prominence is on the same side as the small parts, while face is cephalic prominence is on the same side as the back. So Miss Anne, I hope you understand all the 4 maneuvers that I have discussed to you. So ma'am, would you like to go to the bathroom now in order to empty your bladder? So Ma'am Anne, I want you to lie your back and I'm going to put pillow or a towel to support your hips. Are you ready, ma'am? Now, let your patient lay her back with her knees flexed slightly and place a small pillow or folded towel under one hip. Now, perform hand hygiene by washing your hands with warm water. Then, dry it up and apply alcohol, then wear your gloves. Now, stand beside the client facing her head with your dominant hand nearest her. Then after you do the first procedures, you have to prepare now your clients before doing the first to fourth maneuver. And once ready, do the first maneuver. Now, palpate the uterine fundus to determine which fetal part occupies the uterine fundus. Ma'am Anne, I will do now the second maneuver, so I have to palpate each side of your maternal abdomen to determine which side is the fetal back and which is the extremities of your baby. As I have touched the fetal back of your baby, I will now auscultate the fetal heart tone of your baby. And as you feel it, it lies within your left side of your abdomen. Now, Ma'am Anne, I will be proceeding to the third maneuver. I will palpate the area above the symphysis pubis to determine the presenting part of your baby and if the fetus is already engaged, because this maneuver will validate also the findings of the first maneuver. Now, Ma'am Anne, I will proceed now to the last maneuver, which is the fourth maneuver. Now, I'll be palpating in the direction of the pelvic inlet using 3 fingers of each hand and determine the presenting part. This maneuver is less informative if the presenting part is breached. And before I validate her data, I have to do the aftercare first. And to validate Miss Anne's data, she is approximately 36-week pregnant, and before we do the procedure, we've discussed all the 4 maneuvers, and she emptied her bladder and I asked her to be in a comfortable position. Now, discard your PPE appropriately and perform hand hygiene.
Okay, so to interpret the results in first maneuver, I have touched the buttocks of her baby and her baby is in cephalic position. And while in the second maneuver, I have touched the fetal back and fetal extremities of her baby and also auscultated her fetal back to know the fetal heart tone, which is 120 beats per minute, and it's normal. And for the third maneuver, her baby is already engaged, and for the fourth maneuver, her presenting part or the presentation is vertex. And I don't have any significant findings that I should report in my nurse supervisor or physician. And for the documentation, I have also documented and record the findings in the chart using an appropriate terminologies. And for the evaluation, her fetal position is in cephalic position and the presentation is vertex, and the fetal heart sound is 120 beats per minute.